So we treated this asymmetry by blocking the pelvis so that we don't twist his lumbar spine, and very gently just taking this to a natural end range and then just staying there. Very gentle force for 2 minutes. We do this, the left hip goes into external rotation. We do that for 2 minutes. And now lie on your back. So then I cross this leg over and I stretch the hip and pelvis to the right. And then I do a lateral stretch with a little bit of traction. Hopefully I'm not pinching in the joint there. And we stretch all of his medial and even the medial hamstring and the adductor muscles and the hip and the pelvis and the low back stretches with that. And we do that for 2 minutes. Now after we did that, he walked down the hall twice and you reported that you felt more symmetrical. Mm-hmm. Okay? Now you're still asymmetrical in the front of your pelvis. I can't discern any difference, and that's not subtle. This is not a subtle asymmetry. It's very apparent. I would say, that it's on the order of maybe an inch lower on the right side. Okay? But you have normal spring mobility, so this is not the ilium being rotated on the sacrum being stuck. That's not happening in the sacroiliac joint. This is the way his bones developed. And it's not a posterior rotation of the left ilium because he has good inferior spring mobility. Okay? So lie on your stomach now. And you'll notice that he has more space now. Now he has, does the camera see that? Can you see that through the camera?
Yeah.
All right. So he definitely gained space here. It's still asymmetrical, but to a lesser degree. But now you can see that I can push on the sit bone and I can spring it. And on this side I can push it and it definitely moves further until it gets to an end point. That's called taking up the slack, but I can then spring it. And I can spring it this way. Okay? And then I can spring. I can take up the slack and I can spring this ischium laterally. The sacrotuberous ligament now has normal tone. Okay? So I just teach him those same stretches. I would do those daily for a week, and then I would do them once a week for 6 weeks. Maybe do them once a week forever. Okay? So you just lay on your stomach, and you can help him with this stretch, alrighty? So you just block the pelvis and you stretch that medially, laterally, and then you block the pelvis again and take this one that way for 2 minutes, and then on his back, lay on your back again. So you cross this leg over and then you stretch this one medially like that, and then this one, you give a little bit of traction to the joint and then you stretch it into abduction. But do not provoke any discomfort with those. If there's discomfort, just back up a little bit. It'll still be beneficial.
Okay.
All right? So now, bend both knees. Okay? And feet are equal. And those heights look even now. And the length of the femur looks even now. That's really interesting. And when you sat, they were symmetrical now. Go ahead and go and sit one more time in that chair. So we've somewhat altered the positioning of the lower pelvis, and in response to that, you no longer look taller on the left tibia, and this looks very subtly longer, okay? Do you feel any different sitting?
It feels right.
Is that a difference? Is that a change?
Yes.
Okay.
After we put that on,
Okay, so
and then took it out. I
ignore
noticed
that part. I'm talking about now. Right now, how does your pelvis feel?
It's good. It does feel mostly symmetrical.
Okay, so now put that under the right sit bone. And earlier that helped you before I treated you.
Mm-hmm.
I can't perceive any difference with that under there. But how does it feel?
It's I don't think it would bother me if it was there, but
Does it feel like less helpful?
yeah.
Okay.
Yeah.
Okay, so I don't think you need
I
it.
don't.
I don't think you need it. So when you change movement in one plane, you also change movement in the other. So you probably have an improvement in vertical dimension of the pelvis, but I just can't perceive it with my eyes. But I'm guessing that you really don't need this.
Fantastic.
Yeah. And interestingly, now in sitting, I can't perceive asymmetry in the pelvis. So, very interesting. Nice case study on what's called a lower left windswept pelvis. Thank you very much.
Thank you.
Yep.